Let's rationalize your section in your module with serial key MEREEN-1158. Client has urinary calculi that is composed of uric acid, and the nurse teaches the client dietary measures to prevent further development of the calculi. The nurse determines that the client understands the dietary measure if the client states that it is necessary to avoid consuming which among the following. The answer here is Dallas, because of the word organ meat, fine bones, and fish. This food is high in uric acid. Okay, while these three, A, B, and C, these are high in calcium, which is contraindicated if the stone, if the calculi is made up of calcium. But since it's uric acid, that's the answer. Next, 62. A client with acute pyelonephritis is scheduled for a voiding cystourethrogram. Client is very shy and modest. The nurse determined that this client would benefit from increased support and teaching about the procedure because so we're talking about or we're trying to find what's the reason why would this client benefit from support and teaching about the procedure. Why is it important to teach or to into uh, give a overview about the procedure to the client? Is it because of A, radioactive materials inserted? No. B, radiopaque contrast is injected. They're basically one and the same. A and B are similar, that's why we eliminate them. Answer, letter C. The fact that the client must void while voiding process is being filmed, and the fact that the client is shy, it's very important to teach the client about the procedure because having a knowledge about the procedure will support the client and it will minimize stress. Okay, it will minimize stress. So it's like making the client more comfortable knowing that knowing about the procedure. So C is the answer. Next, number 63. Client says to the nurse, I can't get any help with my care. I call and call, but the nurse never answered my light. Last night, one of them told me she had other clients beside me. I'm very sick, but the nurse don't care. Which of the following statement from the nurse is therapeutic? A. I think you are being very impatient. The nurse come as quickly as they can. Eliminate. I think this is non-therapeutic because remember we're looking for something that is therapeutic here. Okay, letter A is non-therapeutic because this is nurse-centered and you're not actually addressing the concern of the client. B, I can hear your anger. The nurse had no right to speak to you that way. I will report her. Eliminate this because this is a form of splitting. Okay, if you don't know what splitting is, please review your therapeutic communications for your under your psychiatric nursing. C. It's hard to be in bed and to have to ask for help. You feel the nurse do not seem to care. Or D. You poor thing. You poor thing. This is what? This is demeaning or it's like discriminating the client. Okay? So eliminate the answer. Letter C. Of all, this will facilitate verbalization of feelings. That's why the answer is letter C. Next, number 64. Family member of a client who attempted suicide are tearful. Which statement by the nurse would be therapeutic? A. I'll check on when you will be able to see your loved one. Eliminate because um, we're looking for something a therapeutic response and the situation does not suggest that the family members are asking about the time that they can check their loved one. Okay, so this is an inappropriate or this is not not the issue. Okay, so element A. B. Believe me when I say that everything possible is being done is a form of false reassurance. So between C and D, the answer here is Dallas again. Letter C, don't worry. Okay, this is also a form of what? False reassurance. This is the answer. I certainly can see that you are terribly worried about your loved one. This is what? Acknowledging the failing of your client. This is acknowledging the client, the feeling of your, for the family of the client. This is the answer. Next, number 65. A nurse is caring for an 11-year-old child who has been abused. The nurse includes which therapeutic action in the plan of care? A. Encourage the child to fear the abuser. Eliminate, because this will what? Reinforce fear. It will reinforce fear, and this should be discouraged. Next, let's eliminate C and D, because this letter C and D are asking client. This is asking client to do something beyond his capability. Okay, teaching the child to make wise decision. Remember, your client is just 11 years old, and have the child point out the abuser if he or she should visit while the child is hospitalized. Again, that is too stressful for this client. Best answer, Boston. Provide a care environment that allows for the development of trust is the answer in this question. Next, 66. A nurse is caring for a 12-year-old female client who has been physically and sexually abused by her father. Father angrily approached nurse and says, I'm taking my daughter home. She's told me what you people are up to, and we're out of here. The nurse makes which therapeutic response? A. Your daughter will remain here until the doctor discharges her. I'll call hospital security and the police if you attempt to take her. Eliminate A, because this is verbally abusive. Nurses are not expected to say these things. Verbally abusive. Next, B. Try to listen to me. Try to listen to me. Okay? This option is somewhat lecturing and is not also a therapeutic response. C. Your daughter is ill and needs to be here now. I know you want to help her to recover and that you will work to help everyone straighten out the circumstances that caused this. This is a form of or somewhat demanding. Best answer, Dallas, because it acknowledges the feeling of the father, the behavior of the father. At the same time, it protects the child. Okay, so the best answer here is Dallas. Next, client reports having difficulty concentrating and outbursts of anger, as well as feeling keyed up all the time. The nurse obtained the client history, discovered that symptoms started 6 months ago, and 6 months ago, say, a stressful event happened. The client reveals that around the same time, best friend was killed by shooting while they are talking together. So obviously, there's a stress event that causes the appearance of difficulty of concentrating, outbursts of anger, and so on and so forth. So this is a clear example of letter C, PTSD, post-traumatic stress disorder. So the outbursts of anger and difficulty of concentrating are actually a manifestation of PTSD. So eliminate this, and this one. C is the best answer. Okay. Remember that OCD should be have what? Repetitive behavior. So that's a manifestation. So that's why it's eliminated. Okay. While this one is about what? Fear. And there was no fear mentioned in the situation. Okay. Next. Number 68. A nurse is assessing a client's suicidal potential. Nurse should ask the client which most important question. So you're trying to assess suicidal potential, which means client is at risk. Okay, client is high risk. That's why you're checking suicidal potential. Now, for clients who is high risk for suicide, part of your assessment is to determine if the client has plan of hurting herself. Okay, assessment is to determine plans of hurting self or plans of suicidal attempt. Okay, this should be the focus of your assessment. Best answer, Boston. Element A, C, and D. This has nothing to do with uh, assessing planning plans for suicidal attempt. B is the answer. Next, 22-year-old female client has recently been diagnosed with polycystic kidney disease. The nurse has a series of discussions with the client that are intended to help the client adjust to the disorder. Nurse plan to include which item as part of one of these discussions. So the client is recently diagnosed with polycystic kidney disease. So keyword kidney disease, although fluid restriction may eventually be ordered, but not this time, okay, because it is just a recent diagnosis. So it's too early for this. Next, eliminate C because risk for hypotension, it should be what? Hypertension, not hypotension. So eliminate C. Between B and D, best answer here is Boston. Why? Because this is a genetic disorder, which means it may involve other family members. That's why we need genetic counseling so that family members at risk will also be counseled. That's why B is the answer. We need D. This will not. Depression regarding massive edema is too early. Okay? Although edema and fluid restriction is expected for kidney disease, not in the early stage. Okay? So B is the answer because it may involve other family members. Next, 70. The nurse is admitting a client to the hospital who is to undergo ureterolithotomy for urinary calculi removal. The nurse understands that it is necessary to assess which of the following to determine client's readiness for surgery. Select all that applies. So our question here is which parameters do you need to assess to determine if the client is ready for surgery? Answer here would be 2, 3, 4, and 5. All of these are parameters to assess readiness except 1. Why? Okay. Support group is not really important because going back, the client will only undergo ureterolithotomy, which is simply what removal of your uh, kidney stone. So this is just a simple removal of stone. There's no need for a support group. However, if the client will undergo surgery like cystectomy, when there's a removal of your gallbladder, okay, we all know that client who undergoes cystectomy will now urinate through the, okay, client will now urinate through the bowel. So, if a surgery will involve a permanent change in the body, that's the time we need a support group. Okay? Because support group, the um, effectiveness or the benefit of support group is to feel or to know that you are not the only one having that certain condition. Okay? Conditions like permanent conditions like trigeminal neuralgia, or if you have amputation and you will deal with that you will live the rest of your life having only one feet or leg. That's the time you need a support group because support group will tell you or will make you realize that you are not the only person having that problem. In the case of ureterolithotomy, there's no need for that because this is a simple removal of stone. Best answer is 2, 3, 4, and 5. Next, 71. Nurses teach a client with acute renal failure to include protein in the diet that are considered high quality or complete proteins. In the diet that are, sorry, the nurse determines that client needs further teaching if he indicates that which food item is considered high quality. Answer here is number 71. The nurse is teaching a client with acute renal failure to include proteins in the diet that are considered high quality or complete. Nurse determines that the client needs further teaching if he indicates that which food item is considered high quality. So high quality proteins comes from animal sources. So knowing this, answer, Dallas, this is not an animal source. It's not considered high quality source of protein. D is the answer. Next, 72. Nurse has completed instruction regarding diet and fluid restriction for the client with chronic renal failure. Nurse determined that the client understands the information presented. The client selected which dessert from dietary menu. Eliminate A because this is a form of fluid. Remember, client is what? Is on fluid restriction. Sherbet is also a form of fluid. Ice cream is also a form of fluid. Best answer, cake. Next, nurse has given instruction to the client with chronic renal failure about reducing pruritus from uremia. The nurse determined that the client needs further instruction if the client states to use which item for skincare. A. Mild soap. B. Oil in the bath water. C. Lanolin-based lotion. Or D. Alcohol cleansing pad. So, given the history, the client has pruritus from uremia because the client has chronic renal failure. And we're looking for something that needs further teaching or instruction. So going back, client who has chronic renal failure has itchy skin, and the skin is, aside from being itchy, the skin is expected to be dry. And we all know that alcohol will further increase dryness. That's why this is the answer. Next, number 74. The home care nurse is evaluating a client's understanding of the self-management of trigeminal neuralgia. History of your client, trigeminal neuralgia. Which statement indicates that teaching is necessary? We're looking for something that is negative. A. I should chew on my good side. That is a positive. That is recommended for clients who has trigeminal neuralgia. Next, D. Taking carbamazepine Tegretol will help control my pain. Yes, this is a positive because Tegretol is an anticonvulsant, and anticonvulsants are the drug of choice for trigeminal neuralgia. So, between B and C, the answer here is Boston. Okay, teaching is further needed when the client says, an analgesic will relieve my pain. No, it does not. This is a negative response because the pain in trigeminal neuralgia can only be relieved by anticonvulsant. So, B is the answer. Next, the nurse has implemented a plan of care for a client with cervical 5 spinal cord injury to promote health maintenance. Which client outcome or goals or objective would indicate the effectiveness of the intervention? Now, A. Maintenance of intact skin. B. Regaining of bladder. C. Performance of activities of daily living. Or D. Independent transfer of self. So, based on this situation or options, remember that in a cervical 5 spinal cord injury, you lost or you lose your bladder control. So you cannot regain it anymore. You cannot transfer because client is considered to be quadriplegic. Okay, so client who have cervical 5 spinal cord injury is quadriplegic. Therefore, B, C, D are lost permanently. A is the best answer because this is the only appropriate outcome. Maintenance of intact skin. Okay, next. When preparing a client with spinal cord injury who is experiencing bladder spasm and reflex incontinence for discharge to home, nurse instruct the client to institute which of the following measure to prevent the problem. Answer A. Avoid caffeine. Why? Because caffeine is a bladder irritant. It's a bladder irritant and it will further increase spasms. Take your temperature every day has nothing to do with spasm. Limiting fluid will not prevent spasm, and catheterization is too often. That every 2 hours is too often. So client is will be prone to what? UTI. Best answer is letter A. Next. 77. The nurse teaches a client with spinal cord injury about measures to prevent autonomic hyperreflection. Which statement by the client will indicate the need for additional teaching? So again, we're looking for negative options. Answer, letter C. Because fever and chest pain is not related to autonomic dysreflection. All of the other options are positive. They are all related to autonomic dysreflection. Next. 78. Client in the late active first stage of labor has just reported gush of vaginal fluid. Nurse observed a fetal monitor pattern of variable deceleration during contraction followed by brief acceleration. After that, there is a return to baseline until the next contraction, when the pattern is repeated. On the basis of this data, the nurse prepared initially to. Now, going back to the situation, the client had sudden gush of vaginal fluid indicating rupture of membrane. Now, after this, client indicated variable deceleration, which means there is a cord compression. Now, what is the relation between rupture of membrane and cord compression? And that is because when the mother had already ruptured membrane, there is now a high risk for what you call your prolapse of the cord, wherein the cord goes out to, if this is this mother's cervix, the fallopian tube, the umbilical cord tends to go out. If this happens, there's a what? Compression in this area. And this compression is manifested by variable deceleration. So after rupture of membrane and you see a variable deceleration, it most probably indicates what? Cord compression. Therefore, you need to perform a manual sterile vaginal exam. This is to what? To verify if there is what? Prolapse cord. Best answer is letter C. Next. A nursing student is preparing to conduct a clinical conference regarding cerebral palsy. Which characteristic related to this disorder should the student plan to include in the discussion? A. Cerebral palsy is an infectious disease? No. B. Cerebral palsy is an inflammation? No. Between C and D, best answer, does. Remember that this client have normal IQ. Cerebral clients have normal IQ, and cerebral palsy is a disorder affecting your extra pyramidal tract. And we all know that the extra pyramidal tract is function is for what? For motor function. Therefore, answer is Dallas. Next, nurse determined that a client recovering from a myocardial infarction is exhibiting signs of depression when the client A. reports insomnia at night, B. consume 25% of meal, show little interest in doing plant teaching, C. ignore activity restriction and does not report the experience of chest pain, or D. expresses apprehension about leaving the hospital. Answer: Boston. Consuming 25% is a sign of what? Anorexia. And lack of interest are sign and symptom of depression. Loss of appetite and the withdrawal from activities. B is the answer. So this ends the section titled Marine. Looking forward in the next section. Thank you and goodbye.